Okay, welcome everyone. Let's start in a brief introduction. I'm going to start. Isra Al-Hayani, she, her, hers, Admin Support, Office of Recovery and Resilience. Happy to be with all of you. Drake, you want to introduce yourself?
Yeah, Drake Eubank, the current chair of this committee, still looking for a co-chair to share some of the responsibilities, and otherwise resident of Eugene and a consumer of vast medical and mental health resources at this point. I can't see the list of who's present currently, so if Isra, could you take on the task of calling on people?
Yes, sure. JD?
Hello, everybody. I had a feeling I was going to get called next. It's JD. You use they, them, or turtle for pronoun. I'm in the Springfield, Eugene area, and I'm happy to be here. How about you, Kevin?
Oh, well, I feel kind of on the spot. I don't know if I'm happy to be here. I'm pretty bored at this point. Anyway, my name is Kevin and my pronouns are he, him, and his. I'm the executive director of a policy group called the Oregon Mental Health Consumers Association. And I'm also the producer and sometimes host of a Monday morning healthcare forum podcast for behavioral health workers called Peer Networks. So glad to be here. Thank you.
Thank you, Kevin. Luke, do you want to go next? If you are talking, we can't hear you, Luke.
Great. Yeah, I had a feeling I might have been muted. I was trying to get good. Hi, folks. Good to be with you. Luke Walters here, also known as Luke A. Shooting Star. Today I'm showing up as they, them, and us and we. Because there's a lot happening right now in our communities, and just like filled with this exuberance, and sharing it with all is my pleasure. Here we are. May our ripples ring far and wide. I'm also the chief executive officer of a mutual benefit society called Global Community Designs. We have a project called Wellness Initiative Network that has got some big opportunities on the horizon. So I'm glad to be here with you and doing this work for quality of life improvements. Anybody not checked in yet?
Barb, we have Barb Rainish.
Awesome, Barb. I'm glad you're here with us. Take it away.
Hey, Luke. Good to hear your voice, too. My name... Hold on. Apples are good this time of year. My name is Barb Rainish. I use she, her pronouns. I like apples. I'm in Multnomah County, Portland area. I'm not a member of the OCAC, but when I come to their meetings, I always learn and feel welcome.
Thank you.
And has Kevin gone yet?
Yes, he already gone. Thank you,
Okay.
Bob. We have Robert Lee with us. Robert, you want to introduce yourself?
Good afternoon, everyone. My name is Robert Lee. I serve as one of the senior policy advisors with our government relations team. That I will also be having one of my co-workers or colleagues, Jamie Hins, who serves as the legislative coordinator for behavioral health division, should be also joining here.
Thank you. Drake, back to you.
Can I ask a question of Robert? The gentleman you replaced, what was their name, and are they still working for OHA?
Kaz, no, Kaz, I think was over a year ago.
Okay, so you're replacing
changed
him.
Positions, yeah.
So, you were his successor, is that right?
One of many.
Okay. It'd be great sometime. I don't know if now's appropriate, but sometime it'd be great to catch you up to speed in some of the conflicts that we had with OHA regarding some government legislative work that he was involved in, and we were involved in. Thanks.
Anybody else have any questions? I'm wondering if you could explain your role to folks here. Not everybody knows what the government relations folks do. Robert?
It's a little bit of everything. A lot of it is really working within other departments and divisions within OHA. So much of it is tracking, reviewing, doing policy analysis, and sharing with the respective legislative coordinators throughout the division and its departments, and then responding to legislator inquiries and constituent services.
Do you have any specifics about your role in relationship to the legislation that goes from the division as recommended to the legislature?
So part of government relations has been traditionally and is working with the individual departments and divisions, such as Behavioral Health Division, and their staff to review legislative concepts, which they're the ones who put those forward, and then getting those submitted for the agency request budgets and that process.
And
so much of our role is coordination.
The reason I asked that is there's a specific situation with cause that I wanted to bring up. But before I do that, I'm wondering if you could tell us what legislation the division itself had, our division, which is the behavioral health side, had come up with that they were supporting in the coming session, if you have any ideas about that or any things that have been preloaded. And I think they get priority in the hearings line at the legislature when the session opens. I'm just wondering if you could speak to anything that might be out there that people might be interested in.
And I know that Luke also has a hand up. Luke, did you want to ask a question before I try to respond?
Oh, yeah, please. I can't see anybody, so I'm not the best chair for this particular meeting right now.
Luke, do you want to ask your question before Robert responds?
Yeah, I was just wondering about Jamie's presence, if she's going to be joining us soon, because I had something for both of your attention.
Yeah, she will, but she have a conflict meeting. She said maybe after 12:30 she will be here.
Great. Okay, I'll wait until then. Thanks.
Thank you.
And to better answer your question, Drake, or Chair, we have a number of legislative concepts that were put forward, and those can be found in our agency request budget. I'll also drop into the chat here some of it's a link that provides many of the legislative concept language and also summaries. So hopefully that can be of some use. And then there are also, I think, a number of also presentations to provide overviews of that. And I can also provide a copy to a recorded version of that as well, which might be useful for some of you, depending on what your interests are. So as far as behavioral health is concerned, and excuse me, I'm about going to sneeze. But we have a few pieces, LC 409, that has to do with some technical fixes for Oregon State Hospital. We have a community restoration placeholder in LC 420. There's also a system of care advisory council update in LC 429. There's also an alcohol and drug policy committee membership some updates to that in 438. I think there was also some technical fixes in the LC 450. Then modernization to the Dewey system requirements in 469. And then there was also some modernization of the juvenile restoration statutes in LC 451. But those are primarily, or the primary ones for behavioral health or substance use.
Luke, I still see your hand. Is this from last time?
I raised it again, actually.
Okay.
Can you remind me of your name, your coworker with Jamie?
Yeah, I work with Jamie. My name's Robert Lee.
Oh, Robert. Okay, thank you. I've got a lot on my mind right now, so it's hard for me to retain information.
No problem at all.
Yeah, the stuff that I was going to wait to talk to Jamie about is actually what we're talking about right now. So I should chime in while we're on the conversation in case Jamie's going to be us about other things. So the policy option packages related to behavioral health for 25 to 27 that Jamie supplied to us earlier, what you just referenced, I did look in pretty great entirety, and she asked us some questions to respond about, and so I did create that, and I responded to her. It seemed like a wise strategy for us to, instead of waiting, to create new legislative concepts and stuff, to identify which ones in here potentially could allow us to have some involvement and join forces with which already been proposed. But I've seen some numerous ones in here. You also mentioned Oregon State Hospital, so we have a lot of interest and need for improvements and changes in that area. Is it possible, Robert, that you could just elaborate a little bit on the scope of what's the focus for OSH, briefly?
Yeah, so the LC 409, the technical fixes there, really they're technical in nature to align the statutes and hospital practices to reduce potential confusion for patient, staff, and public without creating more substantive policy changes. Some of it is referring to ORS 426, which primarily refers to process for voluntary admission to Oregon State Hospital under the 4 to 26 codes, one for patients 18 years of age and older, and one for patients under 18. Currently, there's no admission to OSH for under 18. And since we had closed there used to be a children's ward or unit way back when. I think it was like back in 2005.
Exactly.
Back when we had a Portland branch.
Mm-hmm.
And since then, there hasn't been any admitted youth. But the statutes had never been entirely updated to reflect the infrastructure changes. So this is really more to address those issues. That's not an LC that's in my portfolio. That's under somebody else's portfolio. But that's my understanding for that one. It also then adds a few tweaks to the PMHNP side of the 426 code.
Okay, thank you, Robert. It doesn't look like that particular this is going to help us for our needs right now, but what I've identified in the POPs document that Jamie shared earlier was the POP 552 residential plus study we could have some interactivity with our population for the needs here. And beyond, of course. Residential applies to OSH as well. And there's a lot of need for
Yep.
improvements and changes. CMS has come in and just taken so much away. There's so much restrictive, overbearing influence that the quality of life and the well-being and comfort of the people that live here and work here has been severely impacted, and nobody seems to be noticing. And so I'm banging the drum. I'm trying to get people's attention, going, who cares? This is supposed to be a hospital, but it's very inhospitable, actually. How far is it going to go, you know? Thanks. I know this is important to people.
Can I ask a question, Luke, of you?
Drake?
Yeah. Well, you're there at the hospital. Has the patient's council actually defined what they want at any point?
Oh, yeah.
And
Oh, yeah.
and where do those documents go once you guys get them prepared?
They go to the program executive team and the clinical executive team, administrative bodies. But, you know, we're largely like screaming into a vacuum here. So we need the attention of larger figures in this place to really get anything done.
Could you get their permission to forward those things to the council?
That's a good idea, actually. A really good idea. Not everything makes it into the newsletter that's released.
Yeah, that'd be great.
And the advisory council here is largely just this, you know, ineffective process. So I don't want to, you know, rule it out as an option, but we need to be thinking larger strategies. Okay, thanks.
And just
one
for
more
your
thing.
information, Drake and everyone, we have Marquita, Jamie, and Maria join us.
Oh, cool. Welcome. Yay.
Okay. Does anybody else have questions for Robert?
Just about the peer workforce and the Center of Excellence, and that's what I was waiting for Jamie's presence about. So yeah.
Okay. I have one quick question just to kind of get it into the minutes. In that when CAUSE was in place at the Government Relations Department, we had spent almost a year at that point gathering data from around the state and consumers, and had put together a legislative concept that we were promised by agreement with the ORR and the division and the GSA at the time, or GRA at the time, that we would be able to get our bill in the division's pile of bills that they sent in. And I just wanted to find out the potential in future sessions of that actually being honored to the point that we could actually get something that was relevant to the council's suggestions into the mix. Because that process was squelched at a certain point, partly because the new governor and partly because we were not able to get a note to Mother to talk to the legislative council themselves to get our bill configured. That's one question. The other one is very quick also for the most part, and is not just a mention, but I'm just wondering if there's anything in particular for forced commitment or housing that the division is supporting that significantly alters from the division standpoint the status of those two. One is a perennial effort of having the commitment standards tightened, and the other is just the constant need for housing in the community for the population that behavioral health serves.
This is Jamie, him, she, her. So sorry I'm late, everybody. I got double booked, but I can answer the first one and then maybe I'll turn it over to Robert for the second, the civil commitment questions. But for your prior LC, after the short session concluded in March, we started the process that's directed by the governor's office for compiling all the LC requests. And we had a hard time tracking down the OCAC LCs. So the one that you just mentioned, Drake, if you could get that to me and Robert, that would be really helpful because there might be an opportunity to squeeze it in as an amendment to an existing bill or, throughout during when session starts in January. That's one thing. The other part I want to do is for the division, I'm starting a kind of, I don't know what to call it. Right now, we're just kind of calling it the wish list or the future to-do list. So that throughout the year, as we identify, statute changes that we need or recommendations from OCAC or any other advisory committees, we're going to have it all in one place so that when those opportunities come up for us to start submitting LC requests or policy option package, narrative, anything like that, we have it all ready to go. And then, we have one home for all the work that we're putting into to all this. So that way, these things won't fall through the cracks like they seem to have been. So yes, any information you can get to me, Isra and Robert, on especially that LC that you just mentioned, Drake, that would be really, really helpful.
Well,
go ahead.
What has happened in the meantime is that we have actually engaged in a dialogue with the Traditional Healthcare Workers Commission about actually coming up with a common answer that many of those things. And I believe there is a bill separately being submitted by Project Able. Clay Peterson would have authored it. He's an attorney that works as their director. That has to do with peer supervision and peer billing. That is a pretty elaborate effort, and we have not looked over it in our committee yet, but that's something we might eventually support. But I don't know what the division would think of it. But hopefully somebody should be aware of it at some point because they're shopping around for sponsors as we speak. So.
Okay. That would be a question for Robert. I haven't heard of anything.
Yep, have not seen that. Have not seen it or heard of it myself either.
Okay. Somebody will probably is or can forward you a copy of the legislative concept that's been sent in, or if there's something's already been written by legislative council.
Yeah, that'd be helpful. We will probably
not going anywhere, but that's the one other that's the thing most similar to what we had. And then the other part was the getting the certification of peer training programs in a position where peers are essentially in charge of their own trainings. A little problem with that. And that's kind of what we're dealing with the Traditional Healthcare Workers Commission, trying to figure that out so that there's some kind of guardrails so that we don't have all of our work taken away from us.
Okay.
So those are the two main things. So that were in the bill that we tried to write and didn't get. That kind of got butchered before we could talk to legislative council. And of course, they got vetoed immediately because they were not what we asked for.
Oh, okay.
Well,
that's helpful.
Anyway, the other one is the forced commitment and housing bills. If there's anything out there on the horizon that you guys know of.
That one I am going to turn over to Robert. I haven't been in part of all those conversations, so Robert would be best to speak to that.
Yeah, and as far as forced commitment, there isn't anything that I know of on the horizon. We don't have any civil commitment LCs right now. I'm not aware of anything on housing other than our residential plus LC. But it's not, from what I understand, this group is looking at for housing. It's not associated.
Luke, I see your hand.
Yeah, that's what my question is about also. Thanks for asking about civil commitment, because the concerns that affect the PSRB population are severe, and there's not enough attention on the needs of the PSRB community, which housing is a big area. So civil commit and aid and assist, but PSRB is really important. So potentially maybe next year, with enough of our advanced preparation and work put into it, we could have something like a legislative concept in place for that time. But that is a correlation with the residential study, POP 552. And then the two other things that I had curious about were Medicaid behavioral health for adults, and behavioral health workforce investments. It seems like POP 550, behavioral health workforce investments, correlates with that, what is it, 10 million for your workforce, and then the 6 million for the Center of Excellence. So I've been trying to figure out which groups are behind those initiatives and connecting so we can join forces. I provided you some feedback, Jamie, in your questions. I hope you noticed that, by the way.
Yeah, I got your email. Thank you so much, Luke. I haven't been able to go through it yet, but I definitely got it, and I'm excited to go through that. Regarding was it the workforce? Sorry, what a Monday.
It's okay. Workforce.
The workforce POP that you just mentioned, the Center for Excellence and the peer work is going to be, if it goes through, it'll be coordinated through the Office of Recovery and Resiliency, which ISRA works in, and it'll also be in partnership with our Behavioral Health, Equity, and Community Partnerships team. So it'll be a joint effort. Yeah. Does that answer your question, or?
Fiddling with the mute button here on my phone. Yes, it does actually. Considering we're very close with the ORR already, that's very helpful information, because the conversation is already going forth, and the connection with the folk-time organization. So things are proceeding well. I just want to make sure that we're keeping pace with the timelines and the process going forward, so it's maintains some efficacy. The efforts.
Absolutely.
The PSRB population stuff is really pressing, but it's on the horizon. There's a lot of correlation with the peer-run respites. The peer-run respites have been known to be really effective for many communities, but what's the comparable program for PSRB population and even civil commitment? We haven't really started thinking about that stuff yet, but I want to start having those conversations, and I'm really excited about what's on the horizon and that we're part of this. I want to be off the council here in the very near future, but I want to maintain my close proximity to the work.
JD, I see your hand.
I'm not sure if it's completely on topic, but I wanted to find out from the team what's happening behind the scenes where it comes to prior authorization reform. It's something that I've been pretty passionate about, and I'm not sure if any of that's made it through to the higher levels.
It has not been published, JD. We have the altered version, but it's not been targeted and disseminated. The real question at this point would be whether we we had the people from Medicaid come in and essentially meet with us. So it's on the radar that we want that, but the question is whether we want to make a statute or find a rule amendment somewhere, probably in the Medicaid laws, that would require them to do that. And if we're going to do that, the place we would actually take it would be the division. If we want a law, we would have to take it to the legislature. And you sort of kind of have some control over the direction that you want it to head under whatever advisement you want to take. But those are kind of the two paths. And we can wallpaper the place with the request, but the target needs to either be administrative or legislative at this point. And if we're just going to get it to change a rule, which I think is probably the better bet, because that's easier for them to do, then we basically should begin lobbying everybody in the behavioral health side here, all on the usual suspects, starting with Ebony. I know that's not a very good answer. There's a lot of indolence and inactivity involved, but I'm at max capacity right now, and I swear to God, we will get this done.
Okay.
And JD, if you don't mind sending me just a little bit of background about the prior authorization priority for you.
Yeah, I'd be happy to give you the 2-second speech if that's okay, and then I can always send you more later. Prior authorization in its current form is causing a barrier to care for people, not just with physical health, but also with mental health and addiction concerns as well. Whether it's access to medications in timely manners from previous therapy or what have you, to getting into treatment, which we all know the window of opportunity from decision to doing gets really small. And if we have to wait 2 weeks for a prior authorization, that's going to be a barrier. So the 4 points of prior authorization reform that I'm asking for is 24-hour turnaround, which is possible if you have a workforce. That if it's going to be a no, that you deny 2 formulary instead of 2 over the counter. So if I'm going in for antacids, don't deny me to Tums. I would have done Tums already. Deny me to Prilosec, as an example. And if you are going to deny, to tell the person that's hearing in the language and education level of the hearer, not the speaker. So if we have people who are a little illiterate, we have an opportunity to have verbal denials in the language that the person's primary language instead of all English or what have you. And then in sharing with the prior authorization reform that I've asked for with providers, they've said, and they want a state formulary. Right now, they have to guess and check so many times. This insurance says do Tums first. This one says Prilosec. This one says, and if we had a state formulary, we would have less need for prior authorizations because doctors would be able to flow based on best practices better than best negotiations. So with those 4 points of reform, we can minimize how much prior authorization we have, minimize harm that is caused from waiting for whatever concerns, and we can maximize access to appropriate care.
Okay, wow, that's very succinct. Thank you. And none of this was addressed in the prior authorization statute change in House Bill 4002?
I don't know that, House Bill.
Okay, I'll send that out. There was a slight change. I think it was, and Robert, I apologize if I get this wrong, but I think it was to remove prior authorization for buprenorphine, which I think is already implemented, but I'll have to go back and check.
Yeah, that sounds roughly correct. Yeah.
And then should we bring in John English to this part of the conversation since it would fall on his area?
It definitely affects both mental health as well as physical concerns. And a lot of times those camps are so separate, but when you're experiencing in the body, if you're distressed over your acid reflux, it's going to affect your mental health as well.
Absolutely.
Okay.
Drake in the chat is asking for me to articulate the fourth point about the state formulary so it can be included. The state formulary would mean that all insurances within Oregon would base their best practices for the flow of how medications or alternative health or any of that would all be standardized based on best practices, not best negotiations that the company had with the insurance company. And with a state formulary, that and doctors having access to the state formulary, we would have less need for having to have prior authorizations because we would be following a best practices flow. Does that help, Drake?
Yeah, I need that written down so we can include it in what we send out. Because that isn't, we have something generally that deals with that, but those particulars are important.
Okay. I can see about writing it out. I'll get that to you hopefully by the end of the day.
It was
Great. Thank you.
beautiful, JD.
It's a great idea.
Luke, I see your hand.
Oh yeah, I had something to follow up about the previous conversation, but I wanted to allow anybody that hasn't spoken that wanted to bring something forward first. Are we all up to date? Are we all current? Okay.
Any other questions?
So this is, I guess, for you also, Drake. We have the House Bill 2316 meetings commencing for housing funding opportunities, and I was wondering what possible correlations we could draw between all of these processes and efforts and maximize the opportunities, because there's that residential study I was talking about earlier, and how can we leverage our influence there and stuff like that. That's one of my questions.
The feedback from their group is they have an incredibly small amount of money and a very specific task assigned to them, so that any kind of broad policy interest is sort of subservient to that. So I'll keep trying, and you should too.
Mm-hmm.
In the committee.
Okay. Yeah, that meeting's coming up this next week, and
yeah, the amount of dollars is not very much. They're not going to have a very big impact.
No, but seeing in the larger scope of things, the ripple effect can lead to new opportunities after this. The other question is for Kevin. You mentioned Dina Felds, part of the Oregon State Hospital Advisory Board. I've tried to connect, but have been unable to. If there's anything that you can help out or about that, be appreciated. Leverage the networks.
We're done with questions here about for the state folks. I'm wondering if Kevin would like to speak to the reintroduction of Senate Bill 432 and the interest the division might have in supporting that.
Sorry, Drake. Kevin left. He said he had something urgent come.
Oops.
Mm-hmm.
Okay. Are either Jamie or Robert Lee familiar with last session? There was a bill, Senate 432 was a peer technical assistance bill. Does that sound familiar to either of you? It got lost in the big shuffle at the end of the session.
As they do. I'm looking it up now, and we'll see. 432, you said?
Yeah, I think 432.
Last session.
If I remember right, that one was like, yeah, it was 2023.
Oh, it was 23. Okay. Senator Hayden. Oh.
Yep.
This one.
We got us a liberal Republican from Fall Creek.
Yes, it is kind of serendipitous that this is the bill you've just brought up. I just did a training last week for our division, and I used this bill as an example. So let's talk about it. So this bill, do we know what happened in 2023? I wasn't here. So were there...
They didn't even get to put the final amendment in. It didn't go to vote. Didn't have a final hearing.
Oh, okay. I did see one amendment get in.
Yeah, some controversy whether they would allow only consumers or exclude peers that work
Right.
for state dollars. And that was resolved, but it didn't matter because it never got in.
Okay. Are
Yeah,
you
went
thinking...
to Ways and Means.
Oh, did it? Okay. Are you thinking to reintroduce?
As far as I know, Kevin either is going to try to get it through somebody's office as an amendment
Okay.
to the Center for Excellence bill or the larger budgetary process, or otherwise introduce it separately. But the configuration has changed a little bit. The amount for the pure technical assistance portion of it is actually pretty marginal. It's only like 700 only, I should say. I'm not quite that rich to think that's a small amount of money, but it's only like $750,000 basically to provide a wide base of community type assistance and technical assistance for peer organizations and things that just generally lift the people on the bottom up into the workings of either meaningful engagement with the system or meaningful employment or meaningful, a number of different issues that affect that population.
Mm-hmm.
The Technical Assistance Center, so it justifies its name that way. And like I said, he's thinking of trying to get that included in the Peer Center for Excellence because there's quite a bit more money allocated for that for a number of things besides just technical assistance. So that's one thing. But as far as I know, barring that amendment going through in the budget or to be added to the budget and then voted on, it will be introduced as a separate bill and is being prepared right now as a separate bill by Legislative Council. I think it's through Rob Noss's office.
Okay. Okay.
But that's,
So...
again, these are the particulars that Kevin would have been able to speak to a lot more articulately than I can.
Okay.
So, in terms of that, I'm just, I guess I was creating casual conversation about whether that is something that the state would be interested in supporting and how that process would go to try to get state support for it. I know you guys are limited by what the governor is.
Yeah.
Governor
Yeah,
approved.
officially we have no position. So it's a neutral position.
I will say...
Or not even neutral technically.
Yeah. I will say we are, I'm actually really happy to hear that this bill is going to get raised just because I'm trying to keep track of what to expect and prepare a vision for what bills will be coming up. And we have December Ledge Days coming up. That will be, when is it? December 9th starting? Is that right, Robert? It's coming up. And this December Ledge Days will be when the lawmakers come together and for one last time during interim before session starts. And they'll be giving a preview of all the bills that they're going to be trying to introduce. Time willing. I know there's a lot that Rep. Nose is going to be introducing, but Rep. Nose is also chairing the Behavioral Health Committee, and committees get bills as well. So we'll want to watch those hearings, and we'll want to keep an eye out for especially this bill, but any other peer support bills that are going to come through. And let me go to the calendar.
The question that everybody's been asking in the background is there's this big surprise like $10 million or $7 million or $8 million commitment to peer services. And we're trying to figure out who stuck that in there. Do you have any idea where the source of that was? Because it's nobody that we actually know who put that budget together that earmarked those funds out of the $175 million
In the
budget
pot.
for behavioral health. Yeah. So do you know
Yeah,
who would have? No.
that was put together between the governor's office and the behavioral health division as all the budget proposals were being put forward at the beginning of the summer.
Do you have a name for somebody that came up with that particular idea, however?
I think there's several. I kind of came in after it was already put forward. So, and a lot of the staff are either on leave or have moved on to other positions. But so no, I don't have a specific name.
Okay. Well, we thank them, whoever they are, anonymously.
Yes.
We give them our general thanks, and we're very happy that somebody decided to actually commit enough money so that something actually maybe have an impact, we hope.
Yeah.
Plus, there's a lot of people working. I don't know if you were around the last Pure Apocalypse, but they sold out at about 900 or 1,000 attendees. And it was like everybody in their, committee was there from the state's peer population. So that workforce is growing exponentially in a lot of ways. So it's important that there be some infrastructure to support that. The other, and that's pretty much all I have on that. Without Kevin here, I can't go into anymore. He's got a real handle on this stuff because he's been involved in trying to craft the things that might shape the budgetary stuff outside of the division. So,
Okay.
Anybody have any other questions about Senate Bill 432? The reintroduction of it. We've already endorsed it in our last, in the last legislative session, and we'll endorse it. Something similar to it again, I would imagine. That's a guess. And I don't presume anything, but it's likely that the council will see it favorably and vote to endorse it. No questions out there? Everybody quiet? Do we still have attendees? I gotta always ask that one because I can't see anybody.
Yes, we have JD, we have Luke, and Laura Rose join us too.
Welcome, Laura Rose. Laura Rose, do you have any other questions of the state folks, the government relations folks concerning legislation that's out there? They provided us with a link in the chat. Could somebody copy that again for her so Laura Rose can get to that?
I'll do that.
Yeah, let's see. Okay. Take a look. What's the legislative concept 429 about?
Which could you repeat?
429?
I think Robert Lee spoke about that earlier, if I'm not mistaken.
System of Care Advisory Council.
So, yeah, that for LC 429 is simply adding, I think it adds 2 more seats to the System Advisory Council, System of Care Advisory Council, which is
Okay,
overseen
thank
by
you.
Anna Williams. I think it's total of 4, technically. 2 members of public, each of whom are family members, and then 2 of the public who are no more than 25 years of age.
No, thank you.
Okay. Anybody else have any other questions to the point that we're at now? Because I'm going to change into our next agenda item if no.
Drake, we have 1 minute for public comment.
Oh, really? We're there already.
Yeah, now
I
it's
just
public comment.
I can yield my time.
Thank you, Barb.
Thank you. I just wanted to mention that we still have in the back burner from our priorities something that I'm hoping that the government relations folks and the division will take notice of the idea of having Medicaid. Medicaid provides an incredible amount of medical and mental health dollars, and the match is pretty significant. And some of the waivers is up to in the 70% plus range. And those are dollars that can be leveraged. And if somehow housing can be put on that, we had the idea that housing cards could be created to make up some of the differences and the rental disparities around the state, where benefits and rentals basically put everybody that's on benefits or stuck in the system and unemployable or not working at the time, that those folks would have a means to live in a decent place to live in a city of their choice in the state. And the idea would be that the match would provide most of the money. It'd be almost like Section 8, but you would need to have either some kind of language that would change the waiver to do that you were using. And it's probably the HCBS waiver that would be the one that would be the most likely. But having housing cards so that if I can't pay my $1,100 a month one bedroom apartment rent in Portland, and my benefits are only $900 a month, that there's a certain amount available to me on a card that can only be used for housing, and the dollars are provided by Medicaid. I just wanted to put that out there so that people are aware that that's an active thing that's trying to be worked out right now, as another way to leverage dollars so that housing is not denied people that just don't have enough money to, even if there is housing, they don't have enough money to participate in the regular housing market, so that they're left at the mercy of whatever subsidies and other assistance is available. So I don't know if anybody has any comment about that, but I just wanted to get it in the record and get it on the radar of the folks from government relations and the division, that that's something that might be an easier answer than a lot of the things they're trying. And also 2/3 of the money would come from the feds rather than from state general fund dollars, which has got to be attractive to somebody at some point, especially with the political environment we have right now. Okay. Second chance, Barb, you got public comment?
I always learn something when I come here. Thank you, guys.
Okay.
Thank you, Jake, and everybody.
Maria, did you introduce yourself? Could you do that just for those folks that may have not run across you at other venues?
Absolutely, Drake. No worries. Good. Excuse me. Good afternoon, everyone. My name is Mireya Williams. Ella, she, her are my pronouns, and I am the Behavioral Health Metrics and Committee Manager, and just assisting to support this team. Thank you.
Where did you get that background picture? It is glorious.
Thank you. You know, I don't know. It was a while ago. I used it for a PowerPoint, and I just love the water and the sky and the earth. And so brings me joy and peace.
Yeah.
Thank you.
So are you going to get to attend regularly to our committees and council meetings? Is that part of the deal now?
For now, yes. Yes. I do have a conflict on Mondays, the third Monday of the month, because I have a conflict with another meeting, but we'll get here as soon as I can.
This is an exceptional meeting, so normally we would meet on the first Tuesday of each month. So
Even
that's
better. Perfect.
cool.
Thank you, Drake.
Thank you for being here. Thank you for Robert Lee and Jamie attending. We really appreciate your presence and taking the time to listen.
Thank you. Okay, thank you everyone and have a good rest of your day.